So among the drugs that we are going to have on the table and what you're going to use regularly, see what you're going to have on the table in your exam is going to be the drugs that you're going to use very regularly. They are not going to be drugs that are rare. Very regular drugs ही रखते हैं. Nobody keeps very rare drugs, Mexilitine वगैरह कुछ ऐसा कुछ नहीं रहता है. Very simple drugs are kept on the table. Of which one of the simplest drugs to use is amiodarone. Okay, amiodarone would be kept on the table. As a nurse, as I told you, there are only 5 things we are asking for. You know, we are only asking for 5 things when there is a nurse. So you need to know only 5 things. Okay, so what it is, which classification it comes in, what is its use, how does it work, and what are the side effects. These are the only things we are asking. If for doctors and for nurses, we are asking only 5 things. You don't need to go to the depth of anything. But when you come for a class like this, we try to go a little bit more deeper. Okay. We need to go a little bit deeper. That is why I say don't go extremely high on the drugs. Now only before your exams, take those 20-25 drugs that we have and make 5 words of those. Make 5 words on each of those drugs. So in your exam, you will not be flummoxed. In your exam, it will be very simple for you if you know those 5 drugs and 5 words of each of those drugs. Have you made it? I had told you to make it last time. बनाया तुम लोग ने? कल्पना ने बनाया? So I want some show it to me. You show it to me and I will upload it on the website. So that everybody can read it. If कल has Kल्पना made it.
अभी थोड़ा बाकी है, पूरा नहीं बनाया.
नहीं बना के I need it by next class. I want to see it.
Drugs और infusion का दोनों.
Drugs or infusion, only those 5 things we require. ठीक है? वो हमको and that I will once I put it on the website next week I will ask you. Okay, I will ask you next week the same thing. I will ask you. Okay, what is this? What is so? It should be just 5 points. Clear? Similarly, when you say amiodarone, what you should know is a classification. Okay, I am teaching you all the classification. You must say which class it is. Okay, which class? So you have how much? Class 1, class 2, class 3, class 4. ये classes होते हैं anti-arrhythmics का. Anti-arrhythmics का 4 class होते हैं. Class 1, class 2, class 3, class 4. How do I remember it? Class 2 जो रहता है ABCD है ना? ABCD तो class 2 is B. B is beta blocker. Simple? Class 2 A B B. B is beta blocker. तो class 2 is beta blockers. जैसे कि metoprolol हो गया, जैसे कि bisoprolol हो गया. These are class 2 anti-arrhythmic agents. Clear? Class 3 is amiodarone. Class 3 is amiodarone. So the simplest drug in class 3 is amiodarone. ठीक है? Class 4 is adenosine digoxin. Okay, class 4 is adenosine digoxin. Class 4, simple drugs, adenosine digoxin. Class 3 is amiodarone. Right? Class 2 is beta blocker. And class 1 में the drug that you know is lidocaine. There, class 1 is further divided into 3 parts, but we will not go to those 3 parts. Class 1 is divided into A, B, and C. But at least you should know that class 1, the drug that you know of, that you are using, is lidocaine. Xylocard, which we call as Xylocard. What is the difference between lignocaine and Xylocard? Lignocaine cannot be used IV. Xylocard can be used IV. Lignocaine has got a preservative. Xylocard does not have a preservative. That is why lignocaine cannot be given IV. Lignocaine can be used for infiltration. That is why when you are giving local anesthesia, we see whether it is in the vessel or not. Understanding? Whereas Xylocard can be given IV. Okay. So when I say lidocaine, it means Xylocard. Okay. So class 1 is lidocaine. This drug we know. Class 2 is
beta blockers.
Which is the one that you know?
Metoprolol.
Metoprolol. Simple drug. Remember the drug. Metoprolol. What do you know? Class 3 amiodarone. Class 4 adenosine. So ये 4 drug तो आपके टेबल पे रहेगा ही रहेगा. These 4 drugs will be there on your table. Okay, we may not have propofenone, we may not have quinidine, we may not have mexilitine. These are class 1 A, B, C. We don't want to go to that. हम लोग को है नहीं वो ड्रग रहेगा इन टेबल. आपके टेबल पे क्लास 1 का ही रहेगा और क्लास 1 का जो रहेगा वो lidocaine रहेगा. You will be asked about it. On class 2 you will have beta blocker, metoprolol, beta blocker will be there on table. You need to talk about it. Class 3 is amiodarone, 100% will be there on table. And class 4 is adenosine and digoxin, both will be there. Simple? Now amiodarone. So amiodarone is one of the safest antiarrhythmics we know. Amiodarone, safest antiarrhythmics you know. It can be used. What are its uses? Okay, now the one sentence you know. This is a class 3 antiarrhythmic agent. You know one sentence already. Okay. What does it do? It actually blocks calcium channels, blocks sodium channels, and depresses the SA node and the AV node. It causes depression. The pacemaker of the heart becomes slower. Simple. The pacemaker of the heart, you have two pacemakers in the heart, SA node and AV node. It slows down the SA node and AV node. Clear? So it reduces the speed of the SA node. So it will reduce the pulse rate. Clear? It increases something called refractory period of the heart. Let's not get into that. It increases the refractory. Basically, it quietens down the heart. Okay. Clear on this? So where do you use it? Now the next question is, where do you use it? So in one case is where you use it is stable monomorphic ventricular tachycardia. When I say monomorphic ventricular tachycardia, how does that look? Yes, very good, very good. And I'm surprised why you are not able to answer this question when NABH came. You were there on the 11th floor, na? Why weren't you able to answer this simple question? They asked 5 nurses it seems.
But I was not there, sir.
You were not there. Okay, so monomorphic ventricular tachycardia is same morphology, wide complex. Same morphology, wide complex. Okay, if you have wide complex, different morphology also, it is called as polymorphic ventricular tachycardia. Why ventricular? Because broad complex. Why monomorphic? Because it is same. And when it is called polymorphic, it means different shapes but wide. Different shape but is wide. So in and why stable? What 4 things are not there? Shock is not there. Shock हो गया. Then what is not there? Chest pain नहीं है. Altered mental sensorium नहीं है. Breathlessness नहीं है. When these 4 things are not there, it is called as stable. Okay, so stable मतलब क्या हो गया? No chest pain, no LV failure, मतलब no breathlessness, no altered mental status, and no drop in blood pressure, no hypotension. Clear? So stable, monomorphic or polymorphic ventricular tachycardia, the drug to be given is amiodarone. Simple. How do you give amiodarone? So to give amiodarone, we give 150 milligrams. The dose in such cases is 150 milligrams over 10 to 15 minutes. 150 milligrams over 10 to 15 minutes. Then you give 1 milligram per minute for 6 hours and 0.5 milligram per minute for 18 hours. This is the dose. This is the actual book dose. What is the book dose? 150 milligrams over 10 to 15 minutes, followed by 1 milligram per minute over 6 hours, followed by 0.5 milligram per minute over 18 hours. समझ में आया? Now let us calculate. 1 milligram per minute कितना हो गया? 1 milligram per minute 60 milligrams per hour. 60 milligrams per hour. For 6 hours कितना हो गया? 360 हो गया. Now let's do 18 hours. 18 hours कितना हो गया? 0.5 milligram per minute.
900.
कितना हो गया?
900.
तो कैलकुलेट करो.
36.
360 ना?
36, 360.
360 no? 360 मतलब आपको 6 hours का into 3. तो 360 into 3 is 900. Sorry, 900. 1000 something. 1000 something. You understand? That is the amount you need to give. Clear? Clear on this? This is for the IV. Okay, this is for the IV dose. What we do is we give 300 milligrams to begin with, and then we add 900 milligrams over 24 hours. You understand? That is what we do. So when you have monomorphic ventricular tachycardia, 150 milligrams followed by 15 to 20 minutes. If it doesn't deliver, another 150 milligrams, and then you go to 1 milligram per minute over 6 hours and 0.5 milligram per minute over 18 hours. If you don't want to do that, 150 plus 150 plus 900 over 24 hours. Clear? How do you dilute them? 5% dextrose. You dilute them in 5% dextrose. We ensure that we dilute them in 5% dextrose. Right? The other thing that you must understand is once you pass 24 hours, that amiodarone will no longer work. You have to change the infusion. समझ लो तुम्हारा पेशेंट 2 ml per hour पे है, 24 hours वाला 2 ml per hour पे है, बराबर ना? 24 hours 2 ml per hour चालू रखेगा तुम लोग 50 cc को. 2 ml per hour if you have kept it on. Now somebody comes in the middle and says make it 0.5 ml per hour. 24 घंटा होने के बाद that amiodarone will not work. So you have to make a new infusion. Are you understanding? वापस समझाता हूँ. हाँ, we have put the patient in 900 in 50 cc and we have started at 2 ml per hour. What we are expecting कि 24 घंटे में वो निकल जाएगा, बराबर? अभी 6-7 घंटे के बाद कोई कार्डियोलॉजिस्ट आ गया, कोई इंटेंसिव केयर डॉक्टर आ गया और बोला 2 ml per hour नहीं, make it 0.5 ml per hour. अभी ये 0.5 ml तो 3 दिन चलेगा ना?
Yes.
ये 0.5 ml per hour 3 दिन चलेगा, लेकिन हम लोगों को क्या पता है कि 24 घंटे के बाद amiodarone may not work, that infusion may not work. तो इसलिए 24 घंटे के बाद भले ही हम 0.5 ml per hour दे रहे हो, उसको चेंज करना जरूरी है. That's a very important responsibility. After 24 hours, we are supposed to change it. Clear? We have seen that it doesn't work once you keep the infusion for a longer period of time. Clear? समझ में आ रहा है? Any questions?
Sir, 150 का देते हैं ना, तभी
Ideally dextrose, in 5% dextrose, ideally. But it is said normal cell also you can give. But when you are making the infusion, better to make it 5% dextrose. Clear? Clear on this? Alright? Now this is very different from oral. This is very different from oral. ओरल में समझ लो मेरे को लोडिंग देना, पेशेंट स्टेबल है ना, पेशेंट तो खाली बीटैक में है लेकिन स्टेबल है पेशेंट कुछ प्रॉब्लम नहीं है. आई विल डिसाइड टू गिव ओरल. इफ आई वांट टू गिव ओरल, सो नाउ वी हैव कम टू ओरल. ओरल थोड़ा सा अलग है. ओरल में हम क्या करते हैं, उसको 1200 मिलीग्राम टू 2000 मिलीग्राम हम लोग रोज देते हैं 7-8 दिन के लिए. समझ में आ रहा है? इतना डोज हम रोज देते हैं 7 दिन के लिए और फिर 7 दिन के बाद उसको कम करते हैं. क्लियर? दैट इज व्हाट इट इज डन. ओके, सो नाउ द चेंज फ्रॉम आईवी टू ओरल. ये तो ओरल का हम लोग ओरल हम करने ही नहीं वाले हैं. हम वो पेशेंट, ये पेशेंट तो हमारे पास आएगा ही नहीं. जो ओरल वाले रहेंगे तो पेशेंट हम लोग का पेशेंट्स रहेंगे जो आईवी में रहेंगे और फिर ओरल में जाएंगे. राइट? तो हम क्या बोलते हैं, जब हम आईवी देते हैं, okay, and you have given the infusion for 7 days. If you have given the infusion for 7 days, then I need to give at least 600 milligrams to 800 milligrams oral. I need to give how much?
600 to 800.
मतलब 200 मिलीग्राम 3 टैबलेट या 200 मिलीग्राम 4 टैबलेट पर डे. जब हम आईवी टू ओरल स्विच कर रहे हैं, हम लोग भले ही हम लोग 4 दिन 5 दिन देते नहीं है, हम लोग 2 या 3 दिन ही देते हैं. तो इसलिए मिनिमम 600 तो देना जरूरी है. इट इज रॉन्ग टू मेक 200 आईवी एंड देन कन्वर्ट टू 200 ओडी. समझ में आ रहा है? यू अंडरस्टैंड व्हाट आई एम सेइंग? If you are at IV 900 milligrams, you are given today, you are given tomorrow, you are given third day. 3 दिन हम लोगों ने दे दिया है. उसके बाद नेक्स्ट डोज क्या आना चाहिए? 600 मतलब 200 TDS मिनिमम. समझ में आ रहा है? Clear on this? Any doubts here? IV to oral switch, any doubts? इसका हाफ लाइफ कितना है? ये ड्रग एक बार याद रखो कि ये ड्रग जो है ना अंदर once it goes into the body, the half life is 50 days. 50 दिन वो बॉडी के अंदर रहेगा. 50 days. तो समझ में आ रहा है? So you must be very careful before you start the drug. Okay, you must be very careful to start the drug because it's going to remain in the body. जब half life 50 days रहता है मतलब वो बॉडी के अंदर 150 दिन रहेगा. 3 टाइम 4 टाइम्स. जब भी कोई हाफ लाइफ लिखा रहता है ना, उसका 5 टाइम्स ड्यूरेशन के लिए बॉडी के अंदर ड्रग रहता है. 5 टाइम्स. तो अगर 50 है तो 250 डेज अंदर रहेगा वो. समझ में आ रहा है? You must understand that. Okay, the half life is very very prolonged. समझ में आ रहा है? तो तुमने amiodarone कल चालू किया ना, 4 दिन के लिए रहेगा वो. मतलब 4 दिन क्या, 50 डेज के लिए रहेगा मिनिमम. So you must know this. This is one of the drugs where the half life is extended. Clear? So this is in cases of, what we discussed was in cases of monomorphic stable or polymorphic stable ventricular tachycardia. The dose is different when it is cardiac arrest. What is the dose in cardiac arrest? 300 milligrams as a bolus dose, which can be repeated at every 3 to 5 minutes. 300 milligrams bolus dose. It's different from the dose that we gave just now. Clear?
Yes.
Clear on this? What are the side effects of amiodarone? So the first side effect that what you can think of is the first side effect, Sachin? Bradycardia. The first thing, because it is quietening down the heart, the first side effect you can think is bradycardia. Then you have nausea, you have vomiting, you have diarrhea. You can have this patient to have respiratory problems in the long run because it is there for a long time. It may cause problems there. In the long run, it may cause hypothyroidism. Okay, so if a patient has been on amiodarone for a long period of time, he can have hypothyroidism. If the patient is on amiodarone for a long period of time, he can have respiratory problems. He can develop respiratory diseases. Clear? Clear? Huh? So in amiodarone, now you know what class it is.
Third.
Huh? What is the use of this? No, what is that? The pharmacology. Okay, that is what is the pharmacology. It depresses and makes the heart rate slower. It converts the rhythm from arrhythmia to rhythm to sinus rhythm. Then, yoga uses. What is the use of it? In which?
Monomorphic, polymorphic.
Polymorphic ventricular tachycardia, atrial fibrillation, and cardiac arrest. Both what are the doses?
In cardiac arrest,
It's 300. In monomorphic ventricular tachycardia,
150, 150. 150.
150.
Then
1 milligram per minute
for
over
6
6 hours, 0.5
0.5.
milligram per minute over 18 hours. Right? Uses. What are the side effects?
Bradycardia, nausea, vomiting.
Hypothyroidism and long-term care with respiratory problems. Clear? So we finished a simple drug. I have not gone to the depth. When I take for doctors, it is in depth. But of course, itna chahiye hi. Okay, doctors need to know much more than this. Okay, but this is basic that everyone should know. Okay,